Okay, now we're recording. All right, very good. All right, so these labs are due in week 9. I would suggest you go ahead and do them as soon as they become available, and that's going to be well, at least before February 10th. I'm going to run through all 3 of them right now. They're very simple, and most of them are things you've already done. What's different is the paperwork, so I'm not going to duplicate the act of counting. I want you to, because the practice is good for you. But I'm not going to demonstrate the act of counting. You know, pushing the 5 tablets, 5 tablets, 5 tablets into the well. You know, into the carbon. That one up. Into the well in the counting tray. You know, counting. Okay, you got it right. Most of the information, excuse me, I got a terrible cold. Most of the information that you need is in lab number 1. Lab number 2 and lab number 3 are even more simple than lab number 1. Okay, so what you're going to do is wash your hands, put the gloves on, get your counting tray, wipe your counting tray, wipe your spatula. Count to 15, put the 15 tablets in the prescription vial. That'll look roughly like that. Okay, prescription, but they said the orange, I think they call it the orange tablet container. Okay, whatever. Okay, well, I would call it an amber prescription vial, but we all grew up in different places and have different names for stuff. Okay, so you do that, and then you put them in the vial, you label the vial, and then the label will be the name of the product, how many are in there, the date that you did it, and your initial. You can see that on the label. There's a separate large Ziploc bag in your lab kit that's investigational, and it's got all this paperwork, as well as a couple of vials. The tablets, you should have plenty of tablets left over from the rest of the experiments. If you don't, M&Ms, Tic Tacs, doesn't matter. You know, something that more or less looks like tablets that you can count on the counting tray. Whatever you can do. Okay, so you do that, and then you do it again because you got 2 patients here. Okay, and I'm going to sit the information from lab 1 off to the side here, because I'm going to need it again for the other 2 experiments. Once that's done, then you fill out the preparation log, and there are 2 preparation logs, one for patient 1 and one for patient 2. Okay, so there's 2 of them. Okay, and the investigator would be Dr. John Smith. The date would be the date that you're doing it. Number of containers received by the site is 1. Okay, the product name or number would be C13E. That's all in this paragraph on experiment 1. Okay. They came in, they came in a bottle, they came in a Ziploc bag, they came, whatever the description is that they came in. In our case, in my case, I wrote Ziploc bag because I had some placebo tablets in the Ziploc bag. Dosage form and strength. There's no milligram strength indicated in the paperwork for these tablets, and so I'm just putting 1 tablet. That's what it is. That's 1 tablet is 1 tablet. That's what you give. Okay. Authorized prescriber is Dr. John Smith, and that's fine. Dr. John Smith may, in some cases, or I should say, the investigator may, in some cases, designate other physicians, maybe his residents or fellows or whatever, to prescribe these medications. But if if a doctor's name is not on the form, he can't prescribe it. Okay. If another doctor in the hospital knows that we have this drug as an investigational drug, and he has a patient that he knows could benefit from it, he needs to get a hold of Dr. John Smith and get Dr. John Smith to prescribe it. Okay. Because the investigators are required to have a serious amount of control over these investigational drugs and what happens to them and what they get used for. These investigations are as tightly controlled as they can possibly make them, so that the results of the study are as credible as possible. So you can't pick holes in why did it work, why did it not work, all that kind of thing. All right, patient number one, product lot number is 100. That's in the paragraph here. It tells you. Okay. Quantity prepared was 15. If you remember, we counted 15. Okay, you didn't see it, but in the steps in log one, in lab one, you count 15, and then the investigator's initials would be JS. Okay. All right, so that's investigational drug information preparation log. So there's one for patient one, which I filled out, and there's one for patient two, which I did not fill out. The only difference is where it says patient, this is patient number two. All right, so that's that. Experiment number two refers to we've given the drug to patient number one. Okay, and so we're going to take that vial that we counted for patient number one, and we're going to fill out the distribution log for it. Okay, so there's another form, another log. Okay, we're going to fill that out. Okay. Investigators, Dr. John Smith. The date is February 8th. Well, in my case, it's February 8th. It's whatever day you're going to do it. It's patient number one. We don't have a name for these patients. They're just patient number one. And frequently that's the case. The patient's name may be on some obscure log someplace so that we can retrieve it if we need to. But they try to make these studies as blind as possible, so the people interacting with the patients don't subtly, by cues, let them know, are we giving them the drug or are we giving them a placebo? Because a lot of these studies are what they call double blind. In other words, some people get the drug, some people get a tablet that looks like the drug that has no drug in it. And interestingly enough, sometimes the people that get the tablet with no drug in it get well too. If that's beyond a certain percentage, one of the conclusions is that the drug doesn't really work. They were going to get better anyway. Okay. Route of administration is it's oral. Administration directions: take one tablet one time per day. Okay. The investigator's initials are JS for John Smith. The drug is administered by the physician. Okay, and that's in the particular instructions again that were listed under Lab 6, Experiment 1. Okay, it's to be given each day by Dr. John Smith. Okay, so this is a very tightly controlled study apparently. Okay. Drug administered by physician only, and the expiration date is 1 year after the date that you filled out the preparation log. Okay. Okay, 1 year. So that's that. Okay. Now, okay, so that's experiment 2, and then there's experiment 3. Experiment 3 is a situation where the patient says, patient number 2 says, nah, I don't think I want to take this. I'm not doing this. My uncle said that he knows a guy in Mexico that's got a much better drug, and it doesn't have side effects, and it's perfect. If I can go down there and I can get it for $40 a month, and I'm not taking that drug, or something like that. You know, for whatever reason, that patient number 2 was no longer in the study. Okay, so he withdrew from the clinical trial. He's not going to participate. As a result, his prescription was go into storage, and the storage instructions direct you to place the bottle in a cool, dry place out of direct light. If stored correctly, the drug will be stable for 1 year. Cool, dry place does not mean refrigerator. Okay, that would be cool. Room temperature is good. Okay, you don't want because refrigerator is not a dry place; it's kind of a damp place. All right, so you fill this form out. Investigator is Dr. John Smith, and the date is whatever date you do it, and the drug is C13E. The lot number is 100. Storage should be room temperature, protected from light. Okay. After preparation, drug remains stable for, and it tells us that it's stable for a year. We don't have years on this form, so we put 12 months. Okay. Remaining drug and then was returned to stock, and the investigator's initials are JS, and there, bum bum bum. That's it. Okay. So that's what we have, and that's the week 9 labs. There are 3 of them, but as you can see, they're pretty short. They're mostly just paperwork. So I do, however, want you to get in the habit of washing and wiping and so forth. So to go through the procedure with the counting tray, washing hands and applying gloves and disinfecting the counting tray, disinfecting the spatula, that sort of thing. So go through all that and then go through the paperwork. And those are the labs. Okay, and I'll make these available tonight or first thing tomorrow, which will be early in the second week of February. So that they'll be ready practically any time for you. Okay, so that's it. That's it for recordings, except for announcements for this term. So if you need me, get a hold of me. You know my email. And have a good rest of the term.